Welcome to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today, I have the honor of two distinguished guests, the co-founders and co-chairs of the steering committee of the Academy of Master Surgeon Educators, Dr. L.D. Britt, who of course was our president of the American College of Surgeons from 2010 to 2011, amongst many other accomplishments, and Dr. Ajit Sachdeva, who we know as our director of the Division of Education at the college. Welcome, gentlemen.
Thank you. Delighted to be with you.
Delighted to be with you.
Well, thanks for making the time to speak with us today. I'd like to start out with Dr. Britt speaking about the Academy, because I don't think enough people are aware of the Academy, how it came to be, and what it does. So perhaps that might be the starting point for our conversation, Dr. Britt.
Well, thank you. I will. The Academy, a lot of people felt was the establishment of something that will be honorific, but it's not honorific. It's a living organization. We address challenges. If you look at what we've contributed so far, we've contributed a lot to education during this challenging time, COVID. We get people who are true educators, and I think we have a good complement of them. We have our mission. Our mission is to obviously optimize education. Our challenge is to optimize education in this unbelievable environment. And so I'm very proud of the American College of Surgeons. The College of Surgeons has done a lot of things, but I don't think they've done anything like this. I think this has been a real cornerstone for the college. With that, I'm going to turn to my co-chair and let him say a few words about it, because he's really the founder.
Thank you so much, Dr. Britt. The concept of the Academy was presented by our Division of Education to the Board of Regents almost 6 years ago, and it was unanimously and very enthusiastically approved. We set up a steering committee that I have the honor of co-chairing with Dr. Britt. We got a group of preeminent surgeon educators together to create the standards, the criteria for admission, the mission and vision, as Dr. Britt has mentioned. And we formally rolled out the Academy in 2017 and opened the application process in 2018. And that was the first time it was unveiled as an active group. And we had our first set of applicants come in at that time. We inducted our first cohort in 2018, and subsequently we've had cohorts admitted to the Academy in 2019 and most recently in September of 2020. And the latter induction ceremony was virtual. As Dr. Britt has mentioned, our goal is more than just to recognize the best and the best preeminent surgeon educators from the US and across the world. Our goal is to really engage them to contribute to advancing the science of surgical education, to moving the field forward, and to providing mentorship to the more junior colleagues. And as Dr. Britt mentioned, over the last 8 months, we have been very active in addressing the challenges posed by the COVID-19 pandemic on surgery training. And we have made a huge amount of progress, and a lot of those activities have been highlighted in bulletin brief issues and in other venues. And we've had a whole range of activities that have taken off, and we're very excited about it, and there's more to come. Thank you.
Yeah, and let me just add, we have subcommittees. We have a subcommittee on education and recruiting trainees. We have a new subdivision on disaster, on the couriers, like the lister and the webpage and all of that. So we're active, and we have the subcommittee members who are active, and we meet almost weekly if you include all the subcommittees. So again, I'm very proud of that.
Perhaps I could ask the next question about the categories of membership, just so folks are aware at what stage in career they can get involved and to what degree, and perhaps you might take that one first, Dr. Britt.
Well, first let me say we're not excluding anyone, but we have a category of the member who's a senior member. Then we have an associate membership category, and then we have a most recent emeritus, I want to have Dr. Sachdeeva address that.
Thank you, Dr. Britt. As Dr. Britt has mentioned, the member category are the people who are at the pinnacle, the peak of their achievements and accomplishments in surgical education, and that is a lifetime membership. The associate membership are people who are along the way, haven't quite reached that level, but are on the way. And those people are admitted for 5 years. And during the 5 years, they can apply for full membership anytime they think they're ready. And also, we provide them guidance as to how to do that. Or at the end of the 5 years, they can ask for another 5 years of associate membership. Our affiliate category, which was rolled out last year, is for certain people who are not surgeons, but who support the goals of the academy, the PhDs, the people from industry, from various walks of engineering type activities, etc. And as Dr. Britt mentioned, the emeritus category was approved recently for people who have served as full members for 5 years. And after that, if they want to apply for that category or send in a note to us to look at, and we can convert their membership into an emeritus category if they have totally retired from their professional activities.
Thanks very much. Dr. Britt, if I might ask you, what are some of the activities? You mentioned the subcommittees, but particularly during these last few months of COVID, would you mind expanding on some of the education that the Academy has provided?
No, we have certainly put together and published ways in dealing with this challenge where people can continue to be trained, because that's a challenge for a lot of programs. We have ways that people can interact through the lister, through chats and all of that, because we want to be technology ready certainly for the young people who are very into obviously technology learning. And then, as I said before, we have a recent one that's on the disaster. Let's say this happens again. I mean, hopefully we'll never have another COVID, but we may have a disaster where it could challenge training, education. We need to be the go-to organization, the go-to academy to address that, put up paradigms, and how do you approach that?
Thanks very much. Dr. Sachdeeva, could you give us an idea of the size of the Academy, how many inductees per year, or the overall size?
Initially, we had a whole lot of applications, and now it has plateaued a little bit just because the usual process. Initially, there is always a lot of interest and no one is a member, so there's a little bit of a peak and then there is a plateau, but it's been a constant set of applications coming in. Currently, we have 224 members and associate members and affiliates, of which many of them are in the member and associate member category, just a few affiliates. And of course, the emeritus category would go into effect in 2023 when the first founding member cohort reaches the 5-year mark, if somebody wants to be considered for that.
You mentioned a word which I'd like to use for our next part of the conversation. That word is mark. So recently, the Board of Regents also heard a request from the Academy about a mark. Perhaps you could expand upon that theme for us.
Absolutely. We have the Academy's logo and the brand, which has been approved by everyone, including our communications people. We've trademarked it, and that really is our brand. Beyond that, we thought it would be a good idea to have a membership mark for the individual members, because we found that some people were using different kinds of words to describe their membership in the Academy below their name and in their name block. So we thought we should have a unique identifier for members. So we conceived the concept of a membership mark. And the member mark, after a great deal of discussion internally and doing a search about similar marks, we came up with a straightforward title, Member ACS Academy of Master Surgeon Educators, abbreviated as MAMSE. And we proposed to the regents at the October regental meeting that the regents consider and approve this member mark that people could use after their names and put these initials after the MD, FACS, and the other degrees that they might have, if they so chose, and that would identify them as members of the academy. And the regents unanimously approved that request, and that has been put in place. We've informed the members, and there are many benefits other than just putting it in the title. That is only a small piece of it. The main benefits are that it's a unique identifier for people to use consistently. Number two, it allows the recognition of the members individually. It gets the word out as soon as people read their names. It will, I believe, and we believe, build loyalty towards the academy across a lifetime of professional activities. And also it will get the word of the academy out. It will make the academy be more visible nationally and internationally, and would demonstrate the additional value of membership in the academy to non-members, encouraging the younger people to apply for membership and to become full members, and will really strengthen the bonds between the individual members and the academy across their professional careers. So we are very excited about it, and the MAMSE mark has moved forward. We are in the process of creating a certificate with the mark on it that we'll send out to all the full members, and then going forward to all the new members as soon as they're inducted with the full and formal induction certificate, they will get this membership mark certificate as well. And they are more than welcome to use MAMSE after their names. So that's the membership mark. Dr. Brett,
An essential requirement of any developing initiative is branding. And that's part of the branding process that we need to have if we're going to develop.
Thanks very much. And as the brand develops, perhaps we could end with some of your reflections, Dr. Britt, about the future. The brand's been established, 3 classes of inductees, presumably the 4th set of applicants now underway. A lot of work being done with education, publication, subcommittee. Where do you see the Academy heading in the future? What are some of the next goals you have?
I mean, our main goal is to be a best practice for other organizations. Because what we're trying to do is trying to optimize education, the educational environment, when we meet challenges. I mean, we didn't expect this, but I'm glad we had the academy already established. And so to answer your question, I think we want to be a best practice for other organizations.
Thank you. Dr. Sachdeva, and any parting comments on that theme?
Yeah, building on what Dr. Britt has mentioned, this academy is for the whole house of surgery, including all the specialties. And we are delighted with the number of people we have from specialties beyond general surgery in the academy. And we will be equipped to build on what we have done, and not only meet future challenges, but I believe transform surgical education way into the future across the whole continuum, from medical students through residency and fellowship training and into the decades of practice. There's a lot of exciting stuff to come, and we are looking forward to the new vistas that we will explore and the new goals we will definitely achieve. Thank you.
I know we all have nostalgia, but we cannot afford to not embrace that this is a new normal on how you educate. And the academy is leading the way there.
Well, thank you very much, gentlemen, for your time today. Thanks for the work that you've done for us as fellows and as members of the Academy. And most importantly, of course, through the work that you and the rest of the steering committee have done, the way that you've helped our patients, that you've helped us through manage our patients through this crisis, and will continue to do so in the future. So I'm grateful to both of you, and thanks for sharing your time and thoughts.
Thank you very much.
It's been
Happy
a privilege
Thanksgiving.
talking with you. Thank you.
Definitely happy Thanksgiving. A different
Same to
Thanksgiving,
you.
but a happy one.
Okay, thank you.
Thank you.